Okay, so we're going to do Crohn's disease today. And I'm Martin Rutherford. I am a chiropractic physician of 36 years. I'm also a functional medicine practitioner, which is certified functional medicine practitioner, which is more pertinent to what we're going to be talking about today. I'm my sidekick and partner in crime,
Dr. Randall Gates. I'm a board-certified chiropractic neurologist.
And our research maven. And we hadn't planned on doing Crohn's, and it was interesting, though. We had a Crohn's patient come in the other day, and I've treated a lot of Crohn's over a period of time. Again, those of you who haven't seen us, our practice over a period of time relative to some physical problems and some other demands in my life, it ended up changing from a strictly musculoskeletal chiropractic practice into a chronic pain and disease practice in which we treat. Name a chronic disease out there, and we've probably treated it, whether successfully or not. We've at least given it a shot, and we've developed I'm beginning to look at this, some pretty tight protocols relative to what we're treating. I think we might treat a little bit more chronic disease than maybe some, not to insult anybody out there. I'm just telling you why we think we know about Crohn's. And the other day we had a lady came in, and I was interviewing her, and I'm pretty excited about her case. Feels like it's a case that we're probably going to do pretty well with for those of you who have Crohn's without, well, I won't say without drugs, because we don't know that yet. We're not medical doctors, but we work in an integrated fashion with a couple of osteopaths who are pretty conversant in this area. And I told her that if she wanted to know more about what we do for Crohn's disease, that she can look on our poweredhealthtalk.com website. And Dr. Gates informed me we hadn't done anything on Crohn's on our poweredhealthtalk.com website, so we're doing it today. Crohn's, and we didn't talk a whole lot about this topic beforehand. Crohn's disease, it's an inflammatory bowel disease, which is a pretty general, and I'm just going to hit this generally. We'll go into the specifics. Yeah. I'm just kind of set this up here. It's kind of an inflammatory bowel disease. Myself, I've had a bad bowel probably since I was born. I think I've had every inflammatory bowel disease and non-inflammatory bowel disease diagnosis on the planet. Somewhere along the way, I've been diagnosed with irritable bowel, and I've been diagnosed with, I don't have any of this anymore, by the way, but ulcerative colitis. I never was diagnosed with Crohn's, though.
Right. But then you're ultimately diagnosed with celiac disease.
I was ultimately, and I do have celiac, and I'm doing really well with that. And so it's an area of interest for me, no pun intended, really, truly. It's an area of interest for me because it affected my health literally my entire life. And I almost feel like on some level, Crohn's is like an advancement of that, or like a part of that whole picture, of that inflammatory picture. But it is an autoimmune problem, which differentiates it, not necessarily from celiac. It is, for those of you who don't know what celiac is, it's an autoimmune problem where the gluten protein damages the inside of your bowel lining, to keep it real simple. So it's kind of a cousin, maybe, of celiac. I think a point is going to come up about that, maybe.
Yeah, I mean, you can make an argument for that. It's not labeled that way, but you can make an argument.
But the bottom line is most of the folks that come in that I consult with is to determine whether they would be an appropriate patient for our services. They're pretty much done at that point in time. We're usually kind of their last stop, and they're pretty much been told they have to live with it, take steroids. You'll go into that in much greater detail, and that's pretty much it. And it's not necessarily the case, and so that's what we're going to hopefully kind of give you some data today that maybe will give you a little bit of hope, maybe give you a little bit wider perspective on what Crohn's disease is, maybe where Crohn's is going and what people might be telling you in the next 10 or 15 years, and what we're going to be telling you now. So Crohn's disease, I just kind of generally went into it, and I think maybe this is a serious problem. People coming with Crohn's disease are generally having serious symptoms, usually are pretty concerned, usually are, sometimes they've already had some parts of the lady the other day. She's already had 2 parts of her bowel removed, and is feeling better now, but she had 1 part, removed, felt good for 10 years,
Mm-hmm.
and then the second part has come back, and she had that removed, and now she's feeling good again. And we might want to discuss why that is.
Absolutely.
Because we see that, and I said to her, well, this might be a good time for you to be here. This is really good because we can catch it before it starts hitting other parts of your bowel. And so I think that might be something pertinent. What parts of the bowel does it hit, and what does it hit versus ulcerative colitis? I can help out or whatever, do that. So let's go into it. Crohn's disease. What exactly is Crohn's disease? I know that a lot of you probably have already looked this up and know, but we're going to kind of go into this in an organized fashion. Well, I shouldn't say that because I was reviewing a website and it never bothered to mention the fact that it was an autoimmune problem. In like 3 pages, it never said Crohn's disease is an autoimmune problem where your immune system has chronic inflammation attacking your bowel. It didn't say that. So what's Crohn's?
Well, Crohn's is an inflammatory condition that is typically located in the small intestine and then the first part of the colon. So you may know we have the first part of our small intestine, the duodenum. I don't know if we need to go into all that. But there's 3 parts of your small intestines, and then it goes into your colon that then wraps around to your rectum and then your anus. But really, Crohn's can affect anywhere along the GI tract, from the mouth to the anus. And it is associated with inflammation, but that inflammation is secondary to an autoimmune problem where the immune system is really attacking the colon or the small intestine. We'll go into why that's thought
a lot of the
be
patients,
happening.
I'm surprised, but we live in this world. A lot of the patients always say, well, what's an autoimmune problem? More and more people know it before they come in. Right. But still, I'd say at least 50% say, well, what's autoimmune?
And autoimmune is exactly where the immune system starts attacking you, your own tissues. Our immune system is never meant to attack us, ever, ever, ever. We have millions of mechanisms to prevent that. Yes, our immune system can clean up little debris if you sprain your ankle, but it's not meant to kill us at a high level.
And it happens
more commonly. And
a lot of folks will say, oh, this is genetic.
So Crohn's disease does have a genetic component.
Right.
But it's also being acknowledged that Crohn's is becoming more prevalent worldwide in the last couple decades, and they don't know why. And we'll go into some of the hypotheses regarding that. But really, Crohn's disease is a condition of those areas of the alimentary canal, so to speak, which is basically your intestine, your colon. And patients with Crohn's commonly will have cramping, abdominal bloating, bloody diarrhea multiple times a day. It can be confused with ulcerative colitis, and that's why you need a specific diagnostic workup, usually through the gastroenterologist. That is what they do.
Ulcerative colitis, to make a difference, only hits your colon.
Primarily in the colon,
your large
exactly.
intestines, where this can hit you anywhere from here, well, I won't point it down there, to your rectum, anywhere.
Exactly. And Crohn's can be associated with systemic manifestations like arthritis in the spine. It's called enteropathic arthritis, and it's a horrible form of arthritis where your spine actually fuses. And it can be associated with eye inflammation, joint inflammation, skin irritation, and skin conditions. So it's not only a gastrointestinal problem, but a problem throughout the body. So that is what Crohn's is. That's how I describe that.
Oh, that's pretty thorough. And I know a lot of you probably have already researched this and so on and so forth, but in reviewing a couple things, I just thought it might be a good idea because online, the 3 pages I reviewed weren't comprehensive. I'll be polite on that. Mm-hmm. And I think it's important. A lot of our patients come in and they've already looked up online, and it's uncomfortable to try, especially a patient who's very pleased that they've done all the research. It's uncomfortable to try to help them understand it. Maybe there's more to it than what they're saying. So I hope that clears up what Crohn's disease is. And autoimmune problems are generally, just for the record, well, this one has a genetic component. So I was going to say a lot of them are triggered.
Right.
But if you had Crohn's and suddenly it happened out of nowhere and you're getting confused and going, what caused it? It almost doesn't even matter what caused it, but it could be stress. Stress can set it off. And disease can set it off. I had a chronic pneumonia one time, and it set off a bunch of things, not Crohn's, but that can set off. I mean, where I was going with that is what causes the immune system with all those millions of mechanisms. These are questions I'm starting to get. Mm-hmm. I think what's happening is we've been doing this for a long time, and we've seen different waves of patients coming in the door. Used to be people were pretty non-conversant with any of this stuff. And now people are coming in with a much better idea of what may be going on. And one of the things that people are going well, okay, so how come my immune system started attacking me if there's a million reasons?
Right.
And so I don't know. I mean,
and I think we need to take one step back. And why are we talking about the immune system? You know, certified functional medicine practitioner, board certified chiropractic neurologist. Why are we talking about the immune system? Because all of our patients seemingly have autoimmune problems. And so over the last 4 years, we've done a tremendous amount of learning and research on the immune system in order to help our patients with neurological conditions or metabolic conditions of the body. And it's now being seen that 1 out of 6 Americans have an autoimmune problem, according to some statistics. 1 out of 6, that's ridiculous.
When I get out of this, when I get into
in my opinion,
it's totally ridiculous. When I get into this, I started by treating fibromyalgia. I had zero. I mean, first 3 or 4. Maybe some of you have that too, because that could even go along with this. Yeah. You know, I was listening to some of the histories, the first histories, and I thought, oh my God, what am I getting myself into here? I thought there was going to be a million things that I'm going to have to learn to get better at this. And there was. But really, I had no idea we were going to have to become really, really conversant in autoimmune problems, thyroid problems, gut problems. Those are really the biggies, and adrenal and stress issues. I mean, those are the 4 big things that we really, really deal with, like, consistently. There's like 100 other things that you have to deal with to figure those out and get them handled. But Crohn's is where the rubber meets the road. The gut seems to be, in a lot of the autoimmune cases, to calm it down and to get it going and get it to stop the downward progress, to reverse it, to get as much healing out of that person as you can. It seems like, for the most part, the gut is kind of where the rubber meets the road. And you have Crohn's disease. And I'm only saying that to kind of give you, again, a little bit of a background. You might be sitting there going, oh my God, I'm stressed out of my mind. And yeah, my endocrinologist says, you know, their thyroid's driving me, my thyroid's driving them crazy. These can all be parts of trying to calm down an immune response, and Crohn's is an immune problem. And to us, all immune problems have a similar approach. So Crohn's is so that's kind of a little bit more of a kind of a, okay, this is what you may be dealing with out there. It may not just be your gut. It may be other seemingly disparate parts that you're not connecting with your gut. And Dr. Gates is going to get into that more thoroughly a little bit later. So symptoms, what were you, I mean,
yeah, kind of what I said before: bloody diarrhea, abdominal cramping, bloating. It's very common for Crohn's disease patients to have flare-ups where they have a bad period for a couple weeks and then it seems to go away or reduce in severity. As you said, it can be associated with stress. It can also be associated with certain foods. We're going to get into that in depth, but not yet. And lots of times Crohn's disease patients can develop some really serious complications in the gastrointestinal tract, like intestinal blockage. And that's why a lot of patients have to have surgery, because the intestinal contents can't move through because it's constricted down so much. They can develop abscesses. We have seen that in all areas of the gastrointestinal tract, as well as fistulas, where maybe intestines.
Right. Most of these diseases in the gut are kind of local, more or less, or they don't hit, but this can kind of eat right all the way through your intestines.
But yeah, basically you can get a fistula where you get this little like tunnel that forms from your intestines to places like the bladder. It's wild. Or you can get a fistula from your anal area out to the skin. So a lot of not fun manifestations of Crohn's disease. It is a serious, serious problem that, you know, patients with Crohn's disease, unfortunately, lots of times are almost prisoners to the toilet because you can't go anywhere because you have to, you know, go to the bathroom 3 times.
The gentleman who was from San Francisco. Talk about stress. This gentleman was a very nice man, but he's a big-time defense attorney out of San Francisco. And his big win early on in his treatment was he could travel from his house to our office without worrying about it. And it was a big deal. Now
he's doing well.
Now he's doing well. Yeah. He can ski and all that type of stuff. But so how do you diagnose this? And I asked that rhetorically. Okay, I'm trying to like be the host here. Dr. Gates has done like 99% of the research on this. No matter what, every week, I think I know what we're going to do. I think I'm in on it. And then he says like 5 things I've never heard of before. So this is like almost a learning experience for me. I'm like, oh, I didn't know that. You know, I've only been in practice 36 years, So I know how Crohn's is diagnosed, but let's talk about how Crohn's is diagnosed, and maybe a little bit of what our approach might be. When I say our approach, I'm talking about now about a functional medicine approach.
Okay. Crohn's is diagnosed primarily with MRIs, CTs, and barium swallows, just because the small intestine is most commonly involved in Crohn's disease. So it's really hard to see from like a colonoscopy. Sometimes if you have colon involvement, the colonoscopy will pick it up. But lots of times you need those imaging modalities to see the inflammation in the intestines or maybe the obstructions. There are blood tests that are now being employed, like the anti-Saccharomyces cerevisiae antibody, referred to as an ASCA antibody. But it's around 37% sensitive or something like that. So it's not too accurate. But
what that means is like if you have 10 people who have Crohn's, and you get tested, only 4 will test to have it. So 6 people will be told, well, right, we don't know if you have it or not, or you don't have it. Yeah. So it's not very good. A lot of people ask me about that sensitivity, specificity.
Exactly. And then, but they are seen with those antibodies, interestingly enough, if the gastroenterologist can get into the GI tract and take a little biopsy out, those antibodies have much greater sensitivities and specificity. That was one of the articles we attached to this broadcast. There's like 16 of them. So if you want to review any of the data that we're talking about today, we have it there available for you. But that is primarily how Crohn's disease is diagnosed.
So primarily through standard medical procedures.
Standard medical procedures. There's some other antibody tests that are coming onto the market, like an OMP-C antibody. It's to Escherichia coli, but that is not commonly employed.
And that's really helpful to us because a lot of the things we treat, like fibromyalgia, even peripheral neuropathy, those of you who don't know what it is, it's numbness, tingling, burning in the feet. Sometimes they'll get standard, well, most of the time fibromyalgia patients won't have a clue why they have what they have. But peripheral neuropathy, which is pretty well known out there, you can even have tests that are supposed to be definitive for it that will show that the person doesn't have it when they're screaming peripheral neuropathy. And the functional world, and I can't speak for everybody in the functional world, but what attracted me to the functional world was it embraced all the aspects of the different disciplines that worked. My mentor strongly Dr. Tatis Karazian, if you're out there listening, was strongly in favor of marrying in an integrated fashion with the medical community. And I'd say probably 20% of our patients, would that be about fair?
Absolutely.
About 20% of our patients will use an integrated approach with. But the nice part is when a person comes in with a Crohn's diagnosis, we know they have Crohn's. And it's not like you can't muscle test it. I'm not anti-muscle testing. Not completely. Or, you can't, there's just not, you need to get, because we get a lot of people come in, and I mean, they're just like.
On that subject, some practitioners are really good at muscle testing. Other practitioners are not, who think they're good.
Would you hang your hat on a muscle test for this?
I wouldn't say that, but like there's a doctor here that we're friends with who's very good at muscle testing.
He's very good.
She is very good, I feel.
Oh, and we had another doctor before you got here who was excellent at it. Okay. I wouldn't hang my hat on that.
It's just not you or me.
I'm trying to
give
these people.
Go about it.
Well, I'm trying to give you. We're going to argue here. I want you to get solid data. If you're going to an AK practitioner, that's fine for a lot of things. But my point is going to be, this is a medical diagnosis.
Right. This is.
You need to go. You need to get it done. And the reason I'm saying that is I have dogmatic patients that go, no, the medical profession stinks. They suck. They don't know what they're doing. I'm never going to them. I'm not. Don't be that way. There are aspects of almost every type of chronic disease in which the marriage between the alternative, not that I consider us alternative, and specific and correct aspects of the medical community and their model are necessary for you to get the best result. And so I think it's an important point. Just what I'm saying. I'm not knocking the AK guys. I'm not. Right. I'm just saying same thing. There's stuff that we don't do cancer. Okay, we don't do cancer. There's stuff that everything's good for. If you got bowel problems and they say go do a colonoscopy, do it. Do it. If it comes out normal and you still have all the symptoms, come and see somebody like a functional medicine practitioner. Mm-hmm. Okay, so treatment.
Okay.
Treatment. It's an autoimmune problem.
And so the focus there is primarily on decreasing inflammation, decreasing the diarrhea. The way the inflammation is decreased, there's drugs such as mesalamine, which are just basically anti-inflammatories. You can take corticosteroids like prednisone. There are other more powerful medications like Imuran, Remicade, and Humira. These are now being more commonly employed. A lot of our Crohn's disease patients have been on them. A lot of gastroenterologists are liking the results they're seeing with them. Some of them are relatively new, so there's not a lot of long-term data on the efficacy of them. They just know that at 5 years, it really decreases the incidence of relapse, things of that nature. So that is the medical approach aside from surgery. And most Crohn's disease patients, it's referred to, end up having to have surgery just because of the inflammation in the bowel and the fact that things can't get through.
In the medical model.
In the medical model.
You will, if you go with that model, okay, that is usually the ultimate end to it. Is that part of that section of your small intestines or your large bowel is going to ultimately deteriorate to where it's going to become a danger to the rest of your physiology and your life, and then that's going to be removed. And then, as referred to with the other patient, the new patient who came the other day, she had the Crohn's part of her body removed, part of her bowel removed, and she was good for 10 years. But during that 10 years, other parts were being attacked because it's an autoimmune problem. So the attack doesn't go away. Every time you do something to exacerbate the immune system, which we'll talk about, you continue to damage tissue. And the thing about it is it can just hit different parts. You got like 28 feet of bowel, these are averages. You got like 28 feet of bowel, you got like 6 feet of large colon intestines, 28 feet of small, and it can hit anywhere. So it can be a real nightmare if letting it kind of go from here to there. And I kind of got ahead of us way before. Dr. Gates' next topic was going to be what causes Crohn's.
Mm-hmm. This is the fun part.
This is the fun part. This is what got me excited. Let's do this next week because there's a lot of new data out there. It's going to be very valuable data, and this is the part where you're probably going to start hearing some things that you've never heard before, or things that, and Dr. Gates, if I know him properly, will have everything massively documented online. For those of you who are research nerds, it'll all be there so you can kind of delve into this much more than we have time to go into at this point in time. So the causes of Crohn's.
And here I'll back up again. We were at the International Conference of Human Nutrition and Functional Medicine last year. We had the privilege of hearing Dr. Vasquez speak, and Dr. Vasquez wrote a book termed Integrative Rheumatology. And in that, his entire emphasis of the book was such that in standard rheumatology, and you can kind of group Crohn's in with rheumatology because of the arthritis manifestation, that they'll say, with this autoimmune disease, we know that there can be this bacterial trigger, this viral trigger, and this toxin that can be associated with it. And then they'll say, period. And then they go on for chapters talking about the medications they're going to use to, in essence, calm down the immune system. Dr. Vasquez's approach was more to just say, well, why don't we focus in on those triggers? And he's not the only one to do this, but he presented it very eloquently.
I think he was the first one that I've ever seen that put it in an organized
I would agree with that.
Because we were doing most of that.
Right.
I mean, not to be...
Yeah, we were
but we were pretty pleased. We were sitting there kind of looking at each other going, we do that. We do that. We do that. And we definitely did, Dr. Vasquez, if you're watching, we definitely did pick up some majorly good things there that helped to advance our cause. We saw a book last week that was on, or a month ago, that was on chronic disease, Lyme and chronic disease, and that doctor had a 12 point?
16 point.
16 point. Dr. Vasquez's was like 7 points or 8 points or something like that. So yeah, these points we're going to go over they were understood, but now small groups of us have been fortunate enough to be doing this long enough to have been able to see the patterns and put together kind of an organized paradigm to be able to attack these in an organized fashion in which you're not really guessing. You're doing a lot of a lot of like Sherlock Holmesian investigation, but in an organized fashion. So the things that we're going to talk to you about, you're going to be out there thinking, man, I got to go to like 27 different doctors to figure all this out, but you don't.
No.
So this is kind of the fun part, because this really, it lit us up. It was pretty fun. It was nice. It was fun to see we were going in the right direction.
Right.
But it was more fun to see that it just went like, it was like, okay, this makes life a lot easier for us. If it's easier for us, it's easier for our patients. So again, this is just stuff we're sharing with you.
Exactly. And so in a lot of the gastroenterology journals, they'll talk about how Crohn's disease is associated with certain dietary antigens. So basically they notice that all my Crohn's disease patients, they eat certain foods and, they have exacerbations, but no single food allergy or group of food allergies can really be traced to Crohn's disease patients. It seems like every Crohn's disease patient has a different food allergy or a different 10 food allergies. So a lot of the talk right now is on figuring out what those food allergies are, and there's even talk about doing elimination diets, which we do in this office, where basically you strip the diet down and you very significantly, and then you introduce foods back in and see how you feel when you introduce those foods. And if you're a Crohn's disease patient and you get 10 episodes of bloody diarrhea a day, maybe that's indicative of something going on. Now, okay.
Versus the regular food allergy testing,
which is very imprecise.
We have found it to be unreliable
across the board.
And we have theories on that, but most of you have autoimmune problems. As Dr. Gates said, your immune system is attacking you. Your immune system is already looking for things to kill in your body, unfortunately. A point to a lot of celiac patients, or well, celiac too, but Crohn's patients who come in who have been to alternative practitioners who are giving you immune boosters, stop taking them. Okay, I can say that as an alternative practitioner. Okay, your immune system. I didn't mean to laugh there. Okay, okay. One of the viewers a couple weeks ago said he shouldn't laugh. This is a serious problem. It is a serious problem, but you have to be on our side of this, man. So a lot of people come in here with immune boosters. Your immune system needs to be calmed down. It needs to be calmed. What does the steroids do? It decreases inflammation by calming down and/or crushing your immune system. Would probably be better.
Exactly. Same with all those medications I mentioned, except mesalamine.
So
yeah, and so dietary antigens is a big part of it. So could we manipulate your immune system by changing the diet?
I didn't finish that. Yeah. Thank you for picking me up on that. But the point was going to be your immune system's already looking for things to kill. And I think what happens is when they take these tests, like the ELISA tests and all these tests, and you come into me and tell me, I've got 56 different food allergies, I think that the antibodies are so high that they're just sensitive to everything.
Right, and there's probably major foods that are eliciting the immune system more than others. So maybe you're eating cheese that is really causing your immune system to get fired up, and then you have broccoli and it does the same thing, but to a lesser extent.
And like 6 months ago, there was a study that said the same thing we just got done saying, and they said the best way to do it is through the old-fashioned allergy elimination.
Exactly, and I actually attached a study to this broadcast saying exactly that.
So all that for nothing.
No, you didn't. But yes, food is a big part of it that we have seen clinically, and figuring out what the right diet is for you can be imperative. In the studies, they say that it can decrease the incidence of flare-ups, can improve the duration of remission. So it is a very big deal, as well as being cheap and easy and relatively, not too harsh on your system. Whereas a lot of those medications that we mentioned, yeah, they're great for calming down your Crohn's disease, but they have some side effects too. They can increase the incidence of cancer because they're shutting off your immune system. So with all that being said, we also need to look at bacterial, fungal, and parasitic triggers of Crohn's disease as well. We mentioned the anti-Saccharomyces cerevisiae antibodies before, and that's basically a type of yeast. So they're seeing that a certain species of yeast can trigger the immune system to create the Crohn's disease response, as well as a certain type of Escherichia coli protein.
So now they're all going to go on Candida diets.
Candida has been talked about, and you can do that, and maybe that will help you. But also know that lots of times in our experience, we see much more positive results with using natural antibiotics and natural antifungals to get rid of these populations of bad bacteria, as well as trying to starve them. There's a lot of data now saying that these yeast and these bacteria feed on certain types of foods that are really predominant in the American diet. And as I mentioned earlier, Crohn's disease is becoming more and more prevalent. We don't know if it's because of things like the American diet. There's something called the Hygiene Hypothesis, which we may as well just go into right now, which is where they're saying that are we too clean in our country and the industrialized world to where we're not exposed to things like parasites at a young age, and that causes our immune system to be imbalanced and therefore more likely to attack us. But they've done studies where they
stop taking showers every day and stuff.
Live with your gout. Yeah.
Stop washing your food off. I'm just kidding. Okay, but I mean,
But it was
I think there might be some to it.
There might be, and they did studies where they actually infected Crohn's disease patients, some of you may be aware of this, with a certain type of worm called Trichuris. And preliminary results basically stated that they saw some good signs with this type of intervention. However, the follow-up studies basically got knocked down, and they said it wasn't really efficacious for the treatment of Crohn's disease. So just know there's a delicate balance with your immune system in the GI tract, and definitely maybe your immune system is attacking you because certain species of yeast or bacteria or other types of parasites, termed microsporidia, are in there, as well as then dietary antigens, as they term them, food molecules are triggering your immune system to attack your intestines as well, ultimately resulting in Crohn's disease.
Yeah. And yeah, I was going to go on a couple of other things, but I think you might cover those. So one of the things I was going to say is, and I think Dr. Gates also said that, and if he did, just to reiterate it, I mean, essentially what you got to do is you got to find a way to do for your system what the steroids are doing for your system without taking the steroids. And ultimately, I think we want to share with these folks that there is that they have some hope. Everybody's coming in here. I do like the intake interviews. I hear, so when I seem to be impolitely interrupting, what I'm trying to do is answer the questions that I'm seeing every day. People come in, they're scared, they're wondering if we know what the heck we're talking about. They're wondering if they have to suffer like this forever. They're stunned to hear that maybe the downward progress can be stopped, that frequently it can be reversed. In a lot of cases, quite significantly, it can be controlled without drugs. It's a challenge. Mm-hmm. It's a challenge for both the doctor and the patient. But the challenge is really more in the doing. The challenge is more in the, once you figure out, I'm going to tell you right now, he's going to figure out that your 5 favorite foods in the whole world are probably what's bugging you. Before, when I first started doing this, and we didn't have the tools, and the testing was so expensive that and it was unreliable on top of it, that to spend $4,000 out of pocket on tests that were unreliable was not a good way to start off a doctor-patient relationship. And so I would just tell a person, say, here, write down your 5 favorite foods. They would write them down, and I'd look at them, I hand it back, and say, okay, you're not eating these foods for the next 3 months, and they would freak out. They would always feel better. Mm-hmm. They would always feel better, and that's the challenge. But I want to just start kind of winding in here the fact that Crohn's patients can do very well. So a lot of it just depends on the stage.
Yeah, and how long you've had it.
How long it is. But again, the gal came in the other day. Mm-hmm. She was in an end stage. They took out the bad part. Guess what? We're going to be able to help her to have the good parts not be affected. Mm-hmm. Or, I don't know, that's kind of a tedious thing to say, but I mean, that's what that's basically what we have been able to see.
And we've seen Crohn's disease patients where they do well with staying on the very strict diet before we introduce foods, and then they have a burrito, which has, wheat in it, it has beans, it has cheese, it's just a variety of dietary antigens that they may react to, and then all of a sudden their symptoms come back completely. And they can definitely oftentimes see a correlation between what they eat and their symptoms. So you, as a Crohn's disease patient, in our opinion, want to keep your inflammatory levels as low as possible in your GI tract. And then we've also seen patients with Crohn's where we put them on an anti-yeast supplement, and they go from having 10 bowel movements a day to 4. Pretty interesting, right?
Yeah.
And so that is what we see all the time. And these relatively simplistic things out there for those of you suffering and those of you taking these very powerful, great medications in many ways, because they're allowing you to live a better life, but just know that there may be a simpler solution.
And I think
on the horizon,
stress may be something to throw in here.
Because stress imbalances the immune system, and we talked about that balance of the immune system, where they think, well, if we had more parasites as a kid, our immune system would be more balanced. Well, stress imbalances the immune system basically in the same way, and so minimizing your stress levels is completely important.
And it puts out tons of cortisol, which
can break down the gut as well.
All that great, can break down the gut. And the reason I want to bring that out, it's one of the reasons that we married our services. I mean, we do a lot of other things. We do migraine and dizziness and vertigo, which were primarily brain-centered functions and that are affected by a lot of the things that we're talking about. And Dr. Gates more or less cut his teeth on dizziness, vertigo, balance, and migraines. And but it turns out that I think that the brain, and in this particular case, that chronic fight-flight pattern, if you if you were stressed and you're one of those people who can't go to sleep, and then you wake up in the middle of the night, you can't go back to sleep, and your brain's basically going 24 hours a day, you can't shut it off, that's a problem. So you can do all the stuff we're doing, and if that stress mechanism doesn't get under control, it's going to at the very least decrease the ability of that person to improve, if not completely sabotage it, depending on the severity of their stress. To the degree where Dr. Gates has been putting together stress management programs that are drug-free, if you will, that we perform here in the office, but that also can be done at home, and those created a significant change in across the board in our autoimmune patient responses, to the degree where we are at the moment talking about even improving that program because the significance of it has been so much. I mean, I'm not telling you to go out there and get Xanax or anything. I'm not a medical doctor to be telling you that, but you do need to be aware that any type of stress reduction type of a procedure that appeals to you, you should definitely look into, because I've seen that has been the biggest deal breaker for us in virtually our autoimmune cases. I mean, if we can't break that stress, and we know better now, I think, how to evaluate that before they ever get into the program. But it took us a while to really understand that, and I just think that would be one more piece to kind of throw in there, and know that it's not a cause, but it could have been a trigger, and it's definitely a perpetuator and an accelerator of your problem. So. Did anything else? I mean, I think that's pretty
well sums it up.
Yeah.
Yeah.
So I think the message is for Crohn's disease patients. What I get from most of the folks coming in and in their initial interviews is they're pretty despondent, they're pretty depressed, they're pretty much have been told that what they're doing is pretty much all that can be done. Mainly the steroids and the new medications that are out there, and then ultimately part of your bowel is going to go, and that's I was told that one time when I was in my 20s, when I got diagnosed with ulcerative colitis, that I might have a colostomy bag. That kind of shook me up a little bit. It never happened, but that kind of shook me up a little bit, and then so just know that there are things out there. You can research this a little bit more. Dr. Gates, I'm sure, has more than enough for you to chew on for quite some time on his attachments to what we're doing here. And I think that's really the biggest thing that I see in a consult, is when the patient does embrace and understand what we're talking to you about, and that they're actually understand that there may be a way out for them. They calm down quite a bit. And usually by the time we see them for the exam, they go, I feel a little bit better. And I go, yeah, it's because you're not as stressed. It's because you're actually, like, now you're motivated. Now you're going, oh my God, we're going today. Or it looks like maybe there's something that can be done. Boy, that can have a big difference. That can make a big difference in your present clinical picture. So just so take that, and hopefully this is helpful for those of you. Anybody who wants to contact, he answers all the emails, so I don't even know why I say contact us. Anybody who wants more information on this, email him at powerhealthtalk.com, and Dr. Gates is very diligent about returning your questions, and this is one I think you might get some more questions on than usual. So, and
you can also go to our Facebook page, Power Health, as well.
Okay.
Well, thank you for watching.
That was good.
Yeah.